Hey everybody, my name is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and my goal is to make you guys the most educated patients out there. Alright, so I wanted to make a video clearing up a lot of confusion out there. In regards to, you probably came across this video because you're interested in replacing your smile, and you know that there's a lot of options out there. You might have done some research on the internet, or you've gone online, or on TV, you've actually seen some commercials. But there seems to be a lot of confusion, as there rightfully should be, because there's a lot of different options. Again, I want to clear up the air in regards to what a lot of misconceptions may be out there in regards to all your treatment options regarding dental implants and how great they can look and functionality and all these things. So first and foremost, what I really wanted to bring up is I see a lot of patients that come into our office, and one of their main focuses, if not the main focus, is going to be about aesthetics, right? So people obviously are willing to make a big investment, but obviously they want one of their main outcomes to be that they want it to look great. You know, similarly, if they were to go out there and, you know, buy a new home or build a new home, one of the first things that people are looking at are the curb appeal, like how great does a home look outside and how great does a home look inside. And similarly, when we have patients that come in and they're willing to make a big investment in overhauling their smile or, you know, doing something new with their mouth, one of the questions that come into play is how, like, you know, how can, like, what options do I really have to make my teeth look great? And sometimes a lot of patients come in and they think that they have this misconception that if I want to have a beautiful smile, I'm going to have to go the most expensive route. And what I wanted to really clear up is, you know, kind of going into what the different options are. We have, you know, whether it's a complete denture or if it's a implant retained denture, commonly referred to like as a snap-on denture, or if we have a all-on-4, or whether we do individual implants or bridges. Realistically, we can actually get any of those options to look beautiful. And so a patient says, wait a second, you're saying that you can get a regular denture to look great? Wait, you must be lying to me. Like, I've seen my grandma's denture. But the thing is, like, that's actually not true. Even if you were to go with the most affordable option of a regular denture, you can have a premium denture made with, you know, premium teeth, and just working with a great dentist and a great dental laboratory. If you work with that, you know, that dentist that's working with a great team, you can actually have a denture made that looks completely natural, that if even, you know, a patient that had that high-end denture was to go in and to just randomly talk to a dentist at a restaurant, a dentist wouldn't even be able to tell that that patient has a denture in their mouth. So, and I use that as a drastic example that you don't have to spend $100,000 to get a solution that looks, you know, that looks amazing, that could look like natural teeth and look like that beautiful smile that you've always wanted for. Now, the thing that you should know about that, though, is that, you know, people will say, well, great, that's great information. Now I can go get that for $600. Well, the catch again with that is that if you were to ever get a denture for $600, which I think you'd probably be hard pressed to, the aesthetics on that probably are not going to be what you're looking for. Again, there's a difference, like, you know, like, are we talking about, you know, we could have a car is not a car. We could have a low-end car which doesn't have the best aesthetics, and then we can have a high-end car, a Ferrari or a Lamborghini. So I just use that as which can be a very beautiful car. I just use that as an example that we can have, again, a low-end denture versus a high-end denture, and there could be cost differences ranging from $600 to $3,000 for that denture. So again, just letting you know that price isn't everything in regards to if your only objective was to get a beautiful smile, you don't have to break the bank. However, I do want to let you know there's a lot of other things that do come into play other than just aesthetics, and I wanted to go over how all those other different factors come into play in regards to what you should be looking at when you know, deciding on which solution you want to go for. So just to kind of introduce to you guys, all right, so what are my available solutions if I'm looking at basically, you know, overhauling my smile and the function of my teeth? So obviously, again, we were just talking about this as a complete denture, just large pieces of plastic, a large prosthesis we shape like gums and teeth to, you know, for you to be able to function with and, you know, also speak with. Another option would be, that's better than that, would be a snap-on denture. These are both removable options. Okay, now even though that this is implant supported, it snaps in, you can actually take this out. Now for solutions that are not removable, we have two main ones, commonly referred to as all-on-4, teeth in a day, etc., where we place at least 4 dental implants in your jaws. And we have this prosthesis that is not removable. We also have another solution where basically we place individual implants, or we place enough implants to do what we call implant bridges. This is what it would look like inside your mouth. So I want to go over those 4 different options and kind of talk about like what, you know, the pros and cons are of each and compare them to each other. But what are the most important factors that we need to look at when we're looking at those 4 different options? Okay, so I really talked about this from the beginning. Aesthetics. How good does it look now? How long will it look good for? Will there be any wear and tear, any staining? What about function? How effective will my chewing be? How does it compare to natural teeth? Can I chew the foods that I want? Bulk. How bulky is the prosthesis in my mouth? Cost. How much is it today? How much is maintenance? How much are future costs? Smile line. How much of your teeth do you show? And maintenance intervals. How often do you need to have your maintenance? Okay, so I created in graphical form these different factors and basically the 4 different options that we were talking about. So I mentioned this earlier in regards to aesthetics. You know, again, they can all look great. But one thing that I really wanted to clue you guys in on is the fact that, again, a complete denture, you can use cheap quality parts and materials to make it look cheap. And you can also look amazing. You can use amazing parts and materials that can make it look like a beautiful regular denture. And the funny thing is that that whole kind of philosophy goes along this whole spectrum. So implant bridges or individual implants, yes, we can make them look amazing, and also we can use cheaper materials. And that's why you'll see a difference in charges sometimes between, like, you know, different providers. A lot of times people will sit there and say like, hey, all-on-4 is a great bang for your buck. This is what I see on TV commercials all the time. I had a friend that had an all-on-4. Why is one of my friends all-on-4 look amazing, and why does another friend's all-on-4 not look so great? Again, it's the teeth, the actual prosthesis that we use that can make it look, you know, amazing. I wanted to use this and steal this from one of the presentations that I made like a long time ago. I think it was like 2 years, about a year and a half ago. But I had this patient that walked into my office, and these are both all-on-4 prostheses. And so like, wait, what the heck is going on here? Well, you could see that someone might sit there and say, well, what's all this yellow staining going on here? And like, you're telling me this is all-on-4, shouldn't this look amazing? Well, this is an acrylic prosthesis, and so it, you know, attracts bacteria. Meanwhile, this patient has a zirconia prosthesis, which doesn't attract the bacteria, doesn't have the staining over time. And so, you know, again, I just use that as an example that the aesthetics can vary differently, significantly amongst the categories. So again, regular dentures, a big difference. All-on-4, even though you're supposedly getting the most premium product, you can, within the, you know, an all-on-4, pay more money and get a zirconia prosthesis for something that looks great and will look great over time, versus getting, you know, you see on ads on online for these really cheap all-on-4 options, and you go with them and it's almost like a bait and switch, and you're getting the very lowest line teeth. And so, like, you know, 6 months to a year, you're wondering why your teeth are breaking off, or you're getting some staining. So again, there is a lot of confusion out there in regards to, you know, I thought I was getting the highest level of care, but why am I experiencing some of these issues, or why am I not happy about the aesthetics? So those are some of the things that can come into play. And so what I want people to understand are dental implants are literally just the foundation upon which we are building something on top of, right? So if we had, here in Texas, we have foundation issues, and if I was to get the highest level foundation, which is a pier and beam, what type of house that you're building on top of that, what are the quality materials that you're using, what kind of roof you're using, all these different things that come into play in regards to the quality of your house above ground. That's a whole different, you know, like factor in this equation. Okay, so going back to different factors that come into play are also smile lines. So what exactly are we talking with a smile line? You know, are we talking about Julia Roberts when she smiles? Do you see all your gums and teeth? How does that really come into the equation in regards to which solution we can really pick? Well, going back to our little graphical algorithm here, we could see that in regards to smile line, whether you choose a complete denture, snap-on denture, all-on-4, it doesn't really matter how high your smile line or how low it is. But if you do the implant bridge solution that we were going back to, again, what is that? What is that when we're placing a lot of individual implants? Because of the lack of predictability of the bone and gums, it's better that you have a low smile line. So just want to let you know that that would come into play if you wanted to go with that solution. What about function? I mean, to me, function and aesthetics are the most important categories that we're looking at in regards to if I'm going to make an investment or if I'm going to lose my teeth or I'm not happy about my teeth. Function and aesthetics are going to be the most important factors. Well, obviously, if we're doing a complete denture, you're going to have the worst function, right? So a complete denture is a piece of plastic we shape and color to look like gums and teeth. It's a big piece of plastic inside your mouth that has poor retention and stability, so a lot of patients are just really unhappy in regards to the function. Snap-on dentures, yeah, if you're using a traditional denture right now, I would tell patients that if you're in a traditional denture and you want to go to implant supported solution, then a snap-on denture, you're going to be a lot happier with that versus a traditional denture. However, if you have your own natural teeth right now and you just wanted a prettier smile, or you knew like you were going to lose your teeth and you were taking a step back to a snap-on denture and you expect it to going to be like your own natural teeth, no. I've seen way too many patients in the past who have had existing teeth and went to a snap-on denture, and you know, although they know that they're going to be happier with that versus a traditional denture, they still are not as happy as when they had their own natural teeth. Now, when we're talking about an all-on-4, all-on-4 is going to be excellent in regards to function, in regards to coming very close to having their own natural teeth again. Very close, if not as close as having your own natural teeth. And again, with the individual implants and bridges that we see over here, same category. It's your function is going to be excellent, so patients are also very satisfied in regards to their overall function. Now let's talk about bulk. What am I talking about with bulk? Well, are we talking about with, you know, when you have a traditional complete denture, you're going to have a lot of bulk. Again, all that plastic inside your mouth, that can cause gagging, that can cause speech impediments. Even with a complete denture, it's going to cover the, you know, the palate and the taste buds on the roof of your mouth. So you're even going to experience like impaired tasting and just quality of life in regards to like chewing your foods. So because there's a lot of bulk inside your mouth. When we talk about snap-on dentures, let's talk about a snap-on denture bulk. And let's compare that to the bulk with an all-on-4. Side by side, you can see the difference in the bulk. Okay, again, this is the all-on-4 and this is the snap-on denture. So when we look at, again, our graph here, we can see that bulk, snap-on denture, you have a moderate amount of bulk. All-on-4 has less bulk, but what has the least amount of bulk are implant bridges. So let's talk about the bulk. Again, let me show you here. Let's talk about a bulk on all-on-4. Well, we're replacing gums and teeth. So what essentially happens is that because we do have to replace the gum part, if you look at it from the top, you know, you are going to experience, you notice a little bit more added bulk. And so I think a lot of patients who do experience all-on-4, they're like, hey, how come on my tongue side, whether on my upper or lower, I do feel like I experience like a little bit more, you know, bulk down here. You know, that's one thing about the all-on-4 that I want patients to really understand. You're going to have a little bit more bulk associated with having an all-on-4 prosthesis. If you really wanted to minimize that, again, what you would have to go to is the individual implant and bridge solution. Okay, so with that solution, you're going to experience definitely the least amount of bulk. All right, so let's go back to the graph here. Let's talk about cost. Okay, so patients, obviously, if you're talking about the top two categories that they're going to look for, they're going to look at the aesthetics and they're going to look at the function to really decide, help them decide what solution that they're looking for. Well, obviously, we know cost is a huge factor in this. Well, we talked about it before. There's a huge spectrum in regards to each option, right? So there's 4 different options or categories, and even within each category, there are different other subcategories associated with that make a difference in regards to like the cosmetics and materials that we use. Well, Just to generalize it though, like the complete denture is going to be your cheapest solution. Your snap-on denture is going to be the next, you know, more costly solution. Okay, but what are the different factors that are involved with costs? How many dental implants are we going to place? Within an upper snap-on denture, you're going to place 4 to 6 implants. A lower snap-on denture, you're going to place 2 to 4 implants. So how many implants that you choose to get placed are going to have a big factor in regards to like what the cost is of your snap-on denture. Also, are you going to need sinus lifting? How much bone do you have? And also for your actual prosthesis, which is again this, we just been talking about dental implants. What about this part? How good does this look? Because we can make it look amazing or we can make it look cheaper. So how great is it going to last over time? And then also you could see like, you know, longevity too. You know, we accidentally knocked a few teeth out here, right? So with that's another factor that can come into play. But these are all different factors. So a snap-on denture cost could be very variable. It can go from $6,000 to $15,000, $17,000. So there's a big variance in regards to like a snap-on denture. Now, all-on-4 generally is going to be more expensive because there's going to be more overhead for the dentist to be doing an all-on-4 for the patient. So generally, it is a little bit more expensive than a snap-on denture. But in regards to like, you know, dental implants, again, we could be placing 4 implants, 5 implants, 6 implants, but again, you need to place at least 4 implants for an all-on-4. And the actual cost of the prosthesis, whether we're using an acrylic prosthesis or whether we're using a zirconia prosthesis, it goes back into this. And I'd say in the short run, they both look fantastic, but over the long run, due to the staining issues and teeth chipping, breaking off, and also your teeth wearing, and that you need to get these replaced over time, to me, it's a no-brainer in regards to making sure that you go with a zirconia prosthesis. So generally, all-on-4, again, is going to be more expensive than snap-on denture, but you're going to see more variation in cost between the acrylic and the zirconia prosthesis. And then when we're talking about implant bridges, or individual implants, let's again look at this quick x-ray. We are going to have to place, you know, how many implants we place. A lot of times you got to place at least 8 to 10, you know, maybe like, you know, maximum like 12 implants, maybe 14 implants if you're going to place individual implants. But there's a huge variation in regards to the cost. And so in all honesty, like I did this option, my dad, not willingly. It's just that, you know, like what happened on him in the past, and this is not his example. I could show you his x-rays in another video. We started off in his upper left and we did a dental implant bridge and we did a single unit up here. And then the following year he lost another tooth, and the following year he lost another 3 teeth. So on my dad, I placed 6 dental implants, and when we're all in with all the implants, I mean the extractions, plus the bone graft, plus the membranes, plus the sinus lifting that I did, plus the individual implants, plus the abutments and the crowns on top of it, I spent just short of $40,000. That was a street value that I spent on my dad. So the cost component is very variable and is very expensive. And so to me, like, you know, when we're obviously finances are a huge factor for our patients, you know, when they're deciding what solution to go with. Individual implants and bridges, we always give it as an option, but we always know sometimes that, you know, patients, they already think that an all-on-4 is going to be expensive, but to be thinking that it's going to be 50 to, you know, 40 to 50 to even $60,000 to do individual implants and bridges, I don't know how feasible it is for every single patient out there. So finally, what is the long-term maintenance also? So complete denture, you know, it depends, like how well is it sticking inside your mouth. So you might need to get it what we call a reline or lab relines, or get a new denture every few years. So basically that's very variable. Snap-on dentures, that's every 3 to 6 months. And what maintenance really looks like is you go into your dentist, and the most important thing that you need to do is you need to get these nylon inserts replaced, because again, if you put it in, put it out, put it in, put it out, put it in, put it out, like over time, these little nylon inserts, these female parts that, you know, stick in the denture, they lose their retentiveness, so they can fall out a lot easier. So that affects the maintenance. All-on-4, what we want you to do is we want you to come in every 6 to 12 months, because what we're going to do is this all-on-4, this is actually 5 implants, they have these tiny little screws that are actually what we call prosthetic screws that are screwed into the multi-unit abutments that you can't see underneath here. But what we do is we take this off and we go underneath there, we clean everything off, clean everything out, we clean your prosthesis too. And it's a good job, like it's a good idea that you want to do that because it helps keep this prosthesis clean and prevents any bacterial damage that can happen to the implants over time. Just like anything else in life, you want to maintain it. But the good news is that with good materials, zirconia prosthesis, you need to at least clean it at least once a year. Preferably, I like to tell my patients, hey, if you can, I want you to come in twice a year. And then implant bridges function like normal teeth, so you want to get a cleaning at least every 6 months, depending on how good your oral hygiene is and different factors. So, you know, hopefully you guys really were able to see that, you know, like I want patients to understand, don't just watch a commercial on TV. Don't just go on the internet and find out about a Snap-on denture All-on-4 and look at a picture and say, hey, that looks beautiful and that's really what I want to go with. There's many different factors that come into play within the decision tree of what are you really looking for. If it's aesthetics is your only thing, then maybe you should just go with a complete denture. But you're like, well, I also want to be able to chew well, then yeah, the complete denture is not going to be your best option. Similarly, then, like is it the best option to do if I want to get the closest option to replacing my own natural teeth? Individual implants and implant bridges is a great option. It's filthy expensive, and also if you have a high smile line like Julie Roberts, it might not be your best option because there can be inconsistencies of how your teeth look and the gums and how all that comes into play. So really, what you need to do is you need to have a consultation with your dentist / surgeon, and they need to give you and let you know, all right, here are all the things that are going in within your mouth. Here's all the pros and cons of each solution, and this is basically what I would recommend for you. How do you feel about that? So, you know, it's not a one-size-fits-all type of solution when we're deciding to go and pick of which amongst all these categories. So what I recommend is that you find a really good dentist / surgeon and have a consultation with them, and they can, you know, if they're acting in your best interest, they can really point you in the best direction of what they think is best for you. Hopefully, I know this has been a long video, but I really hope that you guys found this information to be useful. If you did, please give me a thumbs up and a follow on our channel. And again, hopefully I'll be, you know, giving you guys a lot more videos in the future that can, you know, make you guys the most educated patients out there. Thank you.